accountable to Minister of Health as our mother ministry. But also, a district being bigger than, in terms of population, bigger than even the ministry, the DHO here would be actually is like also overseas us, because most of the people are in the district. So that the things which makes us parallel with them, our money comes from means of finance, means of health. For them, most of their money comes from through local government. You know, that is the dynamics of government. But when it is the main forum, you'll find that the district is like the DHO is bigger than who? The hospital director, because it covers a wider area. Though the hospital director now oversees the supervisor of the 17 Regional Referral Hospital, I mean district hospitals, because we have now only one Regional Referral, of which those people report to what? In terms of supervision to us, because they get the expertise here. At one point, I attended a meeting in Kampala, they were saying, if the Regional Referral Hospital is now abandoned, let means of local government cut or finance cut the money which is sending to where? To district hospitals through the local government ministry. So that it comes here. Why would they be using the resources meant for here, and yet they leave? Some at time they even take back the medicines.
Because what I want to say,
speaking all about that, we also realize that in these small facilities, these health centers, health center levels, different levels, we have done some medical camps in those areas. Like last time we were in Namanyoni, we realized that even these malaria tags are not there. They don't have them. So you find that when people go there, definitely these people will have to justify them. So there is a very big challenge there down there. They also don't have medicine.
But even there,
yeah. So for them, they assume they will get everything here at the referral hospital done. Because they are not attended to.
Now, that one by they brings you really open sick people. But as a regional referral, we are not supposed to be managing malaria. You get it? We are supposed to manage other
severe diseases.
You get it? Meaning the lower health facilities should be in position to handle that. But I think for some reason, either the patients are lost trust there, or I don't know what's happening down there.
Personnel are never there.
So you'll find that our health personnel here are busy actually attending to cases which should have been
handled at lower
health facilities. By the time it comes to what they are supposed to handle, run to theater and what and this, you get that the place is jammed.
And most of them have their own businesses that they have already mentioned.
So what are we saying? Because this one has an implication for us as a hospital in forms of even utilities. The bills are so high.
People using water,
power. The place is crowded. And we believe most of these patients are supposed to be attended from the lower health facilities. So maybe you can also interest yourself and what is happening down there? What is happening down there? And you remember, these people at some of those facilities in the local government, even were more motivated more than because they wanted to retain them. So why is it that people are really living the other side and coming here?
Because the other time we went to Syrian Center for, we realized the dentist comes once, only on Thursday. The remaining days is not a real consultant.
Of course, we ask the hospital, we can't chase patients. We receive them. You treat them. But what about the other people? They are receiving taxpayers' money as a salary. So why are they not working? You get it? Why are they not working?
That's true.
Well, what is the role of the district or city health officers? What are they doing?
That one you're going to ask them.
Those are the things.
You say arising from this. What are you doing?
Let me attempt to answer.
The management is not according to the guideline. You find they have given the child a lot of training. So comes with complications. And they come with very low HB2 grams 3. So in that critical state, if we take like an hour without accessing blood, we lose. Within those first hour, if action of blood is not there, we lose. And out of the deaths we record here every month, between 35 to 30 a month, but you find that 26 of them had malaria with severe anemia, which was the cause of death.
Children home.
But doctors have just done all the round and we've transferred the stable ones. Then on the ward, we've just transferred the stable ones to the other side. So we handle
their own. So like we put an institute to enable them feed.
Okay.
On liquid food like that. So we had many to that, but I think since we have been managing and now we through, so we transfer them to the stable wards.
Okay.
So that's where they are going. So there are just a few who are remaining, but others are coming. They are doing something. Yeah.
Doctor, what are the biggest challenges you face when you're handling these patients?
Yeah, the challenges, there are not many, but sometimes this oxygen of ours, we run short of it. And sometimes power problems, they affect. So you find when the person is in oxygen, power just goes out. Then sometimes we run short of the emergency drugs.
even at the moment we don't have
At the moment we don't have. So if someone has come as an emergency, you send them to run to the pharmacy.
outside to buy.
Outside to buy. So that is the challenge we normally have. So the numbers are many, but the medicine is sometimes we run short of the emergency drugs.
Musa, you talked about the issue of blood. You said you lost how many people?
Yeah, our average death rate as for current, I can say 30 children per month. But an incident of force, we lacked blood the whole day duty, and during the duty we lost 4 children, just within minutes and hours. So we access blood late in the evening and the night, whereby we had already lost those ones. And our major complications here are severe anemia, which is associated with malaria. They come in with severe malaria with already severe anemia.
And acute kidney injury. So AKI is a great monster here. To find when the kidneys are almost shutting down, so we try what we can, but usually it becomes a challenge. The major thing which is taking our share here, acute kidney injury and severe anemia, those two.
What would be the remedies for someone to compromise such sicknesses?
Now,
Which disease?
Sickle cell disease. It is also among the common conditions we are managing. Like even this one is a sickle cell patient. They come in with complications. Once sickle cell leads to anemia, so all the immune system is affected. So these children are really with somehow some have disability, some have social issues whereby like we've been having one on the ward is now the other side in pediatric, was having no caretaker. Parents have treated and they are now tired. Yeah, some are displaced. So sometimes they come no caretaker, we become caretakers with the fellow with the other caretakers in the ward. And when it comes to a point that no emergency drugs are available, such patients, it is a bit challenging to access all the services. And the next
Yeah. So sometimes they refer them when it is too late.
yes,
Okay.
delayed discharge.
In terms of feeding, nutrition, what should audience, to the public, what foods should they eat, feed their children to avoid such complications?
Yeah, the feeding, they need the nutritious foods containing proteins and carbohydrates mainly, and the foods are needed necessary for our children. And basically, but malnutrition is not a very big challenge. I said not very, but most children think however, we have a number of malnourished children, but not a very big number. I think maybe this time people are harvesting and the food is now available.
Okay, thank you, sir. Yeah, Dr. Chom Francis. Faustin. Okay.
Thank you so much. I'm Willa Christopher. I'm the Regional Coordinator Office of the National Chairperson in charge of Bugisu Sub-Region. Today we had a tour in the hospital on our role of monitoring, because we had received a lot of complaints from the people in our office. But I'm going to speak so much about three issues, starting with what you have just asked me. The President of Uganda passed a directive that all pharmacies, clinics, laboratories and health centers should vacate, being close to regional referral hospitals. But it is very worse and challenging that main hospital, the biggest hospital, almost accommodating the whole of eastern and northern Uganda, it is one of the victims of this. You can't even enter main hospital because of very many clinics, pharmacies, laboratories, and to make the matters worse, they have deployed blockers who are in the hospital. They are diverting people, because most people come to this hospital and they don't know they are. So they are being diverted to pick their attention that the best place is getting medicine out to the hospital, doesn't treat well, and people really go through a lot. That has been a very big concern, and it was addressed, and we're expecting the RCC, who is now the former, to address this issue, but he didn't address it. So the hospital has got that big challenge. Today in our operation and yesterday we managed to find around 3 people who were pretending that they know where they can treat people better than here. They were taking them to their laboratories out. We have the details and I'm going to share to our office. And another key challenge here, last week there is someone who had carried an expectant mother on a motorcycle, who was supposed to come to the hospital. She was in a very bad situation. But when they reached the gate, all the main gate and the Masaba wing gates of Mbale Regional Referral Hospital, they are congested. The main gate has Boda Bodas stages. The Mbale Masaba wing gate has special hires and taxis. And to make matters worse, even the breakdowns parks there. So even if an ambulance is coming, it can't enter the hospital. It's a very big challenge. But no one is addressing this issue. And at the outside gate of the hospital, there is where they dump garbages. They sell charcoal from there, which is also affecting the hygiene of the hospital. So my key issue here is calling upon the RCC Mbale City and the Mbale City leadership, that even if you need allowances, but the welfare of the people, you want them to pay you the revenues, should be taken care of. It is a very challenging issue. It needs a serious address. And there is a lot of insecurity in the hospital. In our 3 days operation here, we have realized that the securities are being brought by few security people, and the Uganda police who is deploying the people is deploying all the people, just expecting retirement. They don't do their work. They can't arrest thieves in the hospital. At 8 people are asleep. The security people are asleep. And currently there are only 4 people who are there. The security police officers, there are only 4. And now it is becoming hard to operate a hospital which is carrying around 20,000 people. Theft here is too much. The hospital has very many institutions. There is Usitema University, there is what? And these institutions are not offering security, but they're only feeding on the security the hospital has. So where is the biggest concern now? Where is the security? Is the key issue here. So I call upon the leadership, Minister of Health, this is a serious issue. See how you empower Mbale Regional Hospital with the security. And also diseases like malaria. These are supposed to be managed by the outside health centers. But the health centers are as if they are not operational. Absenteeism is too much. So it is a very big concern. The hospital is not in a good state. Inside everything is okay. The medics are working. The hospital is clean. We give credit. But insecurity and the outside atmosphere is bad. The road coming to main hospital, it has potholes. You can even plant bananas. where is the money for the roads? Why can't the Mbale City have also that heart of humanity and make good use of these services? The engineer has at least to fill the potholes. If you carry someone on an ambulance and is a patient who is on oxygen, and the ambulance is in a speed, it can't pass it there. Because once it jumps very well, the oxygen even can go off. And we have around 2 cases of people who have died at the gates of Mbale Regional Hospital because they can't access the hospital any time. There is an old man, a Muslim, who died because of pressure. He was just supposed to be entered in the referral hospital, but because a special hire guy had parked wrongly, they had to wait for him, who was seated somewhere. Before he came and removed the car, this person had died. So the Ministry of Health, the Uganda Police, the Mbale City RCC, and the City Clerk, we call upon you to really act on this issue. I think those are my issues and observations.
Omu ku coordinators bazukulu at region, Bugisu region, leero tuli wano mu Mbale Regional Hospital, era bingi nnyo bye tugenze nga tu interactingako ne management ya wano, naye tugenze okizuula nti balinayo challenges. Kubimu bye bafininga nga challenge ye crowdness mu malwaliro muno mu wards. Kyesanga nti abalwadde abasinga obungi tebakyagenda mu health centers at different levels, naye bajja buzi paka wano ku region. Kati nebanga crowdinga wards abasawo ne babanga bafuna ekizibu ky'amaanyi okubanga abantu bajjudde mu ddwaliro, so nga ate ebizibu ng'ebya malaria diseases ebyandibadde bihandlingwa ku health centers. So naye ate n'ekirala kye tulabye ffe according to our findings nti health centers ezo obuzibu bwabwe nti eddagala bo bagamba eddagala teririmu. Yes, amalwaliro agamu tegalimu ddagala mu health centers, naye agamu n'eddagala erijja. Abamu ku bo balina pharmacies, abamu ku bo balina drug shops, eddagala olumu balijjamu abamu. So tubadde tusaba nti mwe naddala abali in charge of those health centers mutwale obuvunaanyizibwa, mumanye nti eddagala eririyo likozesebwa, ate abalwadde abasobodde obatuukirira mu bahandolinge, so si kubanga mubarifaringa bonna mu regional hospital. Regional hospitals handlinga cases nyingi ez'abantu abalwadde. Kozi ne challenge endala regional hospital management gyefunye nti tebalina authority ku bantu ku bana ababeera ebweru ne crowdinga naddala ba Boda Bodas n'aba special hires. Abo bagamba bo tebalina authority, so basaba nti abali mu buvunaanyizibwa naddala ku city basobole okubanga RDCs n'abalala batuyambeko okubanga batwala obuvunaanyizibwa bwabwe to find out nti bakiryaringa away so that abantu abalwadde baba baleese abantu basobole okubanga bayitawo mu bwangu okujjako baleke kubanga bafudde obuzibu ku gates okuba entrance bakavera by these people ababeerawo abo. So byebimu ku bizibu bye tugenze nga tulaba ebivudde mu management ya wano, naye ffe ng'aba ONC tutwala obudde ne tubanga tuwisoblowinga, so betukola nammwe ebweru eyo mubeere nga mukola taking actions mangu nnyo, kubanga ffe kyetwagala okulaba nti abantu baffe babeera mu mbeera ennungi, ng'ate enkolagana ne hospital zaffe nayo nnungi n'ababajjanjaba.
Kama sina ndi Honorable Wandulu Zaidi, ndi coordinator wa ONC Mbale City. Shalero nga ONC wamahuwa ebiseera byeffe kwitsa mu Mbale Main Referral Hospital nga niyo kimirimu mitwera ekyahuweebwa ni ofisi yeffe kubona kuri ku inspectinga kimirimu kya government ku monitoring projects na institutions za government kubona kuri kikyenda bulayi. Mukosi a generalist ndi byesi kutuyire ano shalero kutuyire ndi referral hospital ili ye region referral hospital munu gabe wafune bulwale buchehenga headache malaria binanu ali ni hutimira mu health center 2 health center 3 ni health center 4 ngabya hasikana mu health center 4 ba mu referringa ano mu referral hospital muri ba doctor bayindifu baliho ni bubongo bweyangaki ubutsina bubukhasile health center tsiramire ne unfortunately ndishesi kwa mahutu yano ndi umundu nga ali huulira headache oba ali huuliramo nga khasuja itsa direct mu referral hospital walekha health center 2 health center 3 ni health center 4 watsa wabona ori babandu banji naye balwale banji naye mutsiwodi ni balale bali nisi babarata balale bali nisi bakona ta ari badokita babali yana abandi holere ku bulwalo bukhasire babandu munaye mu health center 1 mu health center 2 health center 3 ni health center 4 bawa tension ku mulwalo witsire ku mukanga busa malaria ni headache watsa wabona ori umulwale sibafaringira no kwitsanga ali mumbera tsimbotsa kumuwalako utsa kwinyolore no mulwale yebulamba bwa relation bwo bwawelewe kila kupirisa local government si ndi kama pesa kakitsa mu local government sani ngakitsa mu system health department babone bari bayilembuka kumotivatinga units tsotso tse health center 2 health center 3 health center 4 siwe babandu bujanjabi ubwikombeswa ku bulwale bwesi bali ni nabo anokufune bajanjabi babali ni bulwale bubukhasire mu health center tso bwe kubona kuri kushendeza kukhwitsula kwe babandu mu referral ya emergency shindi ndi kutuyile ndi insecurity mwidwaliro lino insecurity police iramba ku mulimo koyota era shinyamisire nabindi ukhola mu facility ingali ngene ye region imbufu ngelimo basirikale bane bonyene mulimo OC station OC CID ni basirikale ba uniform babiri atenga bali ku gate indwera yonyene iya Masaba wing igate ramire mbaye wado musirikale wade mutwera kiro bonori shosho ni sheshirera bubu ifibo kali babifibitsa muno ndi babongera kumutambo kwibe bintu bye balwale bibitsire kila kupirisa security RD singa chemano security mu Mbale City abonara making sure kimirimo kimurera hano hulinda abantu ni ibintu byawe making sure abonare institution ingatsino atiwa security email because referral hospital nga ichicheke nabinga wakiserere kana basirikale ngama kumikabiri na unfortunately wa muti basirikale ba uniform babiri bonyene shakozinga insecurity mwidwaliro mu shindi shehu kola Boda Bodas stages batsira mu milyango kiki ku gate tsingisa balwale muno ni special hire babona bari babara ku gate tsingira kuno baba gazettingira ko tsina stage unfortunately shindu shibina because lino lidwaliro lidera balwale bayi babakana tension mangu nga ambulance yitsire ni kwitsa kusa direct yabona eriyolesa mangu mulwale eyo wafuna bujanjabi na unfortunately ndi ambulance yitsa yimika ku gate bapatsi ngombi baba naye baboda bode bakana hurura WhatsApp no residence it's happening abalwale bafira kunana kutsigeti ngabashiri kubakola hota ni shishindi government yabirisa police through his excellence kubona huri ibakola tsi clinic surroundinga lidwaliro era fefe ngaba ONC kubona huri kuri suspicious ku clinic surroundinga kama dwaliro sinyala tsakola kuna events ni kamalisika kakora mu madwaliro kabanga katsemu wenemo kale fe kupirisa huri ihukana tsi clinic tsa hola shina sabanga surrounding lidwaliro libe ni environment yayo imbalayi indayi isi babandu banyala baba mu environment ngendayi mu cosmodrate.
Arising out of our interaction with the administrators of the hospital, Mbale Referral Hospital, there seem to have been some small issues to be settled, which I think requires now the hospital administrators and the city security committee to harmonize in terms of the illegal issues parking around the gate, in terms of special hires, management of police here, Boda Bodas, managing some nurses or doctors. It has been a concern by the administrators, but I think there has been a tremendous improvement in terms of the hygiene. Public health is somehow okay, sanitation is okay. When we moved around the wards, we have seen there is some bit of cleanness, and also where there is garbage management, they have tried, like you are seeing around here, garbage is being managed. Now we call upon those who are the patients' attendants to manage their cleanness around the patients within the wards. Otherwise, on the general note, we see that there has been an improvement. Actually, we appreciate Dr. Obo JS, we appreciate Dr. Oboth, Yona as administrators, and also Bruno, the administrator in the hospital. The team, I think it is doing good work, and above all, they are working closely with the security team. So,
on the issue of having too many pharmacies around the hospital and the health facilities.
About the pharmacies around the hospital, that has also raised some concern. Why we have some bit of our medicines inside, but there has been also reference of the clients to keep on buying medicines outside. But it also has a negative impact in terms of internal management, because they think those pharmacies around the hospital, the owners have a hand. Of those who are operating within the hospital, it seems there is a hand in terms of operations of those hospitals close to the pharmacies close to the hospital. So they are working and looking forward to see that the hospital, the pharmacies around the hospital, they do not undermine the internal operations of the referral hospital. So the administrators, they are working closely to see that there's nothing which impacts on the internal operations.